Hello, everyone. Welcome to our fourth webinar of our parent series. All of our webinars are created for parents of neurodivergent children and teens. So if you have loved ones or are working with individuals with autism, ADHD, or learning disabilities, these are meant for you. We will be holding these webinars every month, and we'll be updating these on our website along with some printable resources. So please check them out if you are interested. Just an FYI, these webinars are recorded and they will be used for promotional and educational purposes. Today's topic is on sleep, and I'd like to introduce a variety of different strategies to target sleep-related challenges. However, I'd like to emphasize that these are all evidence-based behavioral strategies. So if you believe that your child's sleep problems are related to medical issues, these strategies alone may not work. We will also be setting aside some time to address any upcoming questions and frequently asked questions, so please feel free to use the chat box below. Before we get started, I'd like to introduce myself and our company very briefly. My name is Stephanie, and I'm a BCBA. I've been working in the field primarily with children and teens with autism, with the practice of applied behavior analysis, ABA, so most of my content will be related to its practice. This webinar is being presented by our VillageED program through Expatriate Communications. We are a management consulting firm with a team of all fields. We have speech pathologists, psychologists, BCBA like myself, nurses, special education specialists, and we all work together to provide support in special education. We do one-to-one services, parent consultations, IEP support, social emotional learning programs, and much more. So if you are interested in our Village program, I will be introducing our exclusive offer towards the end of this webinar. So diving right in, at the end of this webinar, you will be leaving with some core causes of sleep problems in children and adolescents, simple tricks to a peaceful night for the family, the 5 magical steps to treating sleep problems. These are going to be proposed by Dr. Jin, Dr. Hanley, and Dr. Bolu from an article that they have published. Exclusive resources that will summarize and complement the contents for today's webinar, and lastly, a Q&A session. So what does a good sleep look like? As we might all know, a good sleep would mean the following: a sufficient amount of sleep depending on age. For example, the amount of sleep that a newborn baby needs would definitely differ from what we need. Falling asleep quickly. They say that a healthy sleeper falls asleep within a couple of minutes. Staying asleep throughout the night, waking up feeling refreshed and energized to start the day, and not feeling drowsy throughout the day. Then on the flip side, what do sleep problems look like? Not having enough sleep, we'll go over the recommended number of hours in the next few slides. Having trouble falling asleep, not staying asleep throughout the night, difficulty waking up, and feeling drowsy and tired throughout the day. We're all pretty much experts of both a good sleep and a bad sleep. So now let's talk a little bit about statistics. According to a research, about 25% of all children may have at least one sleep problem by adolescence. However, up to 75% of children with neurological disorders may have sleep problems. So from 25 to 75%, that's a huge jump in the percentage. Now that we know what sleep problems look like and its prevalence, let's look at the core causes of insomnia, especially for those with autism and neurodevelopmental disorders. This beautiful Venn diagram was created by Dr. Mallow and was discussed in our webinar regarding sleep. She breaks down insomnia into 3 main causes: biological, medical, and behavioral, and these causes may overlap each other. The first one here, biological, encompasses factors such as hormonal changes, genes, and sensory oversensitivity. This could be due to natural consequences of neurodevelopment as we go through different development stages in life. It could also be due to simply genes that we were born with. Some medical factors that play into sleep problems or insomnia include sleep apnea, seizures, GI reflux, allergies, sickness, medication side effects, and eczema. Again, as we discussed in the beginning of the webinar, if your child's sleep problems are caused by these biological and medical factors, the strategies being discussed in this webinar may not be very effective. You should be consulted by a doctor or a physician first, just because we want to rule out any medical causes. However, this last section here goes over the behavioral factors, and if you suspect your child's sleep problems are influenced by any of these, you've come to the right place. So some of these behavioral factors include diet, limited energy use, poorly structured evening routines, stimulating activities before bedtime scheduled too early, nap times scheduled too late, and environmental disruptions. So all of these strategies that we will be discussing from now will be effective in treating your children's sleep problems if these are your child's underlying factors for sleep problems. So why is sleep so important? We all know sleep is so crucial and important in our daily functioning. So let's just note a few points. It increases quality of life and daytime functioning. Lack of sleep can cause the following: daytime sleepiness, fatigue, irritability, brain fog, headaches, and slowed reaction time. And we've all been there. On the flip side, with a good sleep, we have being energized and high functioning during the day, able to think clearly, better memory retention and focusing, and positive impact in our social interactions with others. But again, long-term sleep deprivation can cause some serious health deterioration. It can cause hypertension, diabetes, obesity, depression, heart attack, and even stroke. So now let's get into the 5 steps that can help resolve those sleep problems, especially if they were caused by those behavioral factors. And the 5 steps that I will be introducing were pulled from this article by Dr. Jin, Dr. Hanley, and Dr. Bolu. And in their research, they studied the effects of a sleep intervention where they tailored it to each child and family. They had this open-ended interview called a sleep assessment and treatment tool. And based on those results, they created a treatment package to treat the child's sleep problems. Some of those sleep problems include taking a long time to fall asleep, stereotypy, such as body rocking or head shaking, interfering with sleep, tantrums, not being able to sleep independently, and so on. And they did this study on 3 children, and 2 of them were diagnosed with autism. So let's tackle sleep. We'll be discussing these in detail, but here's an overview of the 5 steps. 1, develop an ideal sleep schedule. 2, create an evening routine. 3, optimize the sleeping environment. 4, use sleep dependencies. And 5, target the behaviors interfering with sleep. So before we develop the sleep schedule, we need to consider how much sleep is required. The recommendation is different for all ages and developmental stages. And we can see here on this chart that for infants, children, teens, and for adults, our recommended sleep durations are all different. For example, for infants, we have about 12 to 16 hours, including naps. Children, we have about 11 to 12, even ranging up to 14 hours. Teenagers, we have 8 to 10, and adults, we have 7 or more. And after we determine the recommended hours for sleep, we want to consider things like daily routines and schedules or nap times. For example, if your child is going to school, the wake time would be depending on when his or her school starts and how long it takes to get ready. If your younger child is taking naps, I keep it brief and avoid nap times that are later in the day, such as 5 to 6 p.m. or closer to bedtime. Last consideration here, although there is this recommendation of sleep hours, everyone's ideal sleep schedule may be different. For example, I may function best when I sleep at least 8 hours, whereas someone else might function just as fine with only 5 to 6. So step two is to create an evening routine and there's a lot to cover in this particular step. The way I think about an evening routine is anything from dinner time, showering and bathing, dressing, time for decompressing to finally getting into bed. Every family and every child has a slight variation of an evening routine, and for our younger ones, evening routines are a great way to teach and embed some adaptive living skills such as hand washing, bathing, and showering, dressing, independent eating, and even toileting. We want to develop this evening routine wisely, and we want to recognize what activities are stimulating versus calming for your child. Everyone's is different. So, for example, bathing may be calming for one child, but it may actually be highly stimulating for another. I'm not saying we should eliminate bathing in our evening routine, but maybe we can incorporate bathing earlier in the routine and schedule some more calming activities later on in the routine so that your child goes to bed when he or she is calm and less stimulated. If your child gets super excited watching TV or getting on the iPad, we definitely want to restrict this near bedtime. Diet is also important. Limit sweets and caffeine, which is a given. Also, ensure that your child has sufficient energy expenditure during the day. And we kind of want to tire your child out to bed. You know how after a trip to Disneyland or weekend outings, we see our children exhausted and falling asleep almost immediately? We want something like that to help your child fall asleep. And lastly, prepare for the night. We do this by planning a last bathroom trip, making sure there's water nearby, or having your child drink a bit of water before sleeping, and making sure that your child has his or her teddy bear with him or whichever sleep dependency he or she has. We technically just want to eliminate any excuse your child could make to leave the bed. So, in case you run out of relaxing and calming activities before bedtime, I've noted a few here. We have story time, audiobooks, talking about the day, hugs and kisses, warm baths, breathing exercise, aromatherapy, rocking, swinging, massages, listening to music, and night lights. Again, these are not evidence based activities for relaxing, but these are just a few ideas. I've also worked with a parent who said she goes through naming the different states or locating them on a huge map on the bed on her bedroom wall before bedtime, and that seemed to work with her two boys. Another parent I used to work with took moonwalks before bathing, where they go on a hunt to look for the moon. And I think this is another incredible way to expend energy while also enjoying this as a calming activity. Not only that, it's a great way for bonding and spending time with parents as well. So let's talk about ways to optimize the sleeping environment or your child's bedroom. So we can adjust lighting, room temperature, texture of clothing, and bed sheets, noise level, using white noise if needed, and removing distractions. And this is a big one. We can even embed a cleanup time in the evening routine to have your child say goodbye to their friends and toys just to ensure that this isn't a distraction when sleeping. I'd also remove electronics from the bedroom if you know your child will go for it. For example, I worked with a mom and her teenage son who told me that her son would go to bed pretty early, around 10 p.m., but wakes up so tired and exhausted every morning. One day she found out that he's been on the phone and iPad throughout the entire night. So what she did was to allow enough screen time throughout the day, but having him charge it outside in the living room when he goes to bed. Lastly, make sure that your child feels safe and happy in the room. If your child is always saying things like, I'm scared or I don't want to be alone, spend a lot of high quality time in the room when it's not bedtime. Add pictures in the room, create a warm and happy space together in the room. Ultimately, we want the bedroom to be the perfect place to sleep. So, step four, we want to use sleep dependencies or sleep associations. And what are these sleep associations? Sleep associations or sleep dependencies are cues or conditions that help us fall asleep. For some of us, we may need that specific pillow or that specific blanket. Some of us may even need socks or the fan to sleep. Some other examples include teddy bears, pacifiers, security blankets, pillows, white noise, fan, socks, night lights, and loose clothing. We want to take advantage any of these sleep associations so that your child sleeps well independently with these instead of having you If your child doesn't have one, encourage one to replace having you as their sleep dependency. Step five, our last but very important step, we want to target the behaviors interfering with sleep. And before we target the behaviors, we want to take a step back and understand what is happening and why it's happening. Is your child not sleeping because they're busy playing with toys? Is it because he or she can't fall asleep and is asking for mom and dad? Maybe your child's stimming all night, or maybe there's different items or activities such as electronics interfering with sleep. So try to analyze what is the determining factor that we can help eliminate. And with that information, we want to choose an intervention or a plan. And these strategies can be especially helpful if your child is crying for parents. So the strategies here that we'll discuss right now is time-based visits. The first option here is what we call time-based visits. Having these time-based visits is a procedure that can be helpful if you have a child who is constantly calling for parents or constantly getting out of bed. So in the article that was introduced earlier by Jen and colleagues, one of the participants was actually put on this intervention. And what they did was they had the parent visit the child every so often, and this is completely independent from the child calling for the parent. They gradually increase the time between the intervals. So, for example, the parent would walk in, put the child to bed, bid the child goodnight, and leave the room, all in a very brief and neutral manner. This is done every 5 seconds, then 10 seconds, 30 seconds, 1 minute, and we'll gradually increase it, maybe even up to 10, 30 minutes, and so on. This might look a bit silly because the parent is repeating this bidding goodnight process, but we're also teaching the child not to worry and that the parent will always come back. If the child wanders around between these intervals, the parent would simply guide the child back to bed, again in a very neutral manner, then continue with the scheduled bidding goodnight. Another strategy that we have here is bedtime passes, and this is actually my favorite. I think this is a very fun and creative approach. So, bedtime passes are essentially cards that the child can use to leave their bed for a trip to the bathroom, get a quick hug from parents, and more. However, this would be allowed only within a certain time frame. So, for example, 3 minutes. If the child leaves the bed after using up all the passes, the parent would again simply guide the child back to bed in a very neutral manner. If your child doesn't use up the entire bedtime passes, maybe you can even create an incentive or a reward that your child can make in exchange for that leftover bedtime pass. So, if we have a child who is simply not falling asleep, I would first consider the appropriateness of the bedtime. Maybe it's too early or maybe it's too close to nap time, but if that's not the case, you can simply try this bedtime fading program by Piazza and Fisher. So, you can add 15 to 30 minutes to the current bedtime and then keep your child awake until then. So, for example, if your child's bedtime is 9 p.m., then keep your child awake until 9:30 p.m and then get the child to bed. If your child falls asleep within the new bedtime, 9:30 p.m., great. If your child doesn't, add another 15 to 30 minutes. So you would push that even further to 9:45 or 10 p.m. If you tried all of these strategies on your own and none of these are working, or if you're unsure of which strategy might be most appropriate for your child, try seeking professional assistance. So, speaking of professional assistance, we have a great program to offer. Our Village program not only provides specialists and professionals or a BCBA like myself to provide that one to one consultation, to provide that tailored and individualized support, but we can also provide much more. So, some of our exclusive benefits include unmatched customization, expert guidance with IEPs, comprehensive IEP checklists, a private community, resource library, which I'll share in a minute, on demand support, like I've mentioned, from educational specialists to parents and families nationwide. So these are just a few sample of our free parent resources, and you can see a pamphlet that was created directly aligning to this webinar itself. We have another one here on bullying, teaching social cues, and a worksheet for emotions. So, our resource library has three different categories. We have parent resources, which are these informative pamphlets of a variety of different strategies and topics. We have behavior management and skill acquisition procedures, which is kind of like a step by step protocols for parents that you can use as teachers to teach your child different skills, and some printable activities that you can just quickly print and provide to your students or your children. If you have any questions, please feel free to reach out to us. Our email here is simplesped@xcomweb.com. We have our phone number here, 844-387-5836. We're available Monday through Fridays, 8 through 5:30 p.m. And this is our website over here, so check us out. Before we end this webinar, I'd like to go over some frequently asked questions regarding sleep. So our first one here is, what do I do if my child needs me to be present in the room at all times? And like all other treatments, the key word is being gradual. If you're already sleeping with your child, or if you have to be sitting next to your child, then gradually remove yourself, gradually and slowly. So for example, if your child expects you to cuddle and hold his hand to fall asleep, start by sitting near, but not cuddling or holding hands right next to your child. Then within the next few days, you can slowly remove yourself gradually by sitting a bit further away and closer to the door to exit out of that room, and maybe even keeping your back towards your child too. A common follow-up question that parents may ask in response to this suggestion would be, well, what do I do if my child is continuing to cry for me or asking me to come closer? Briefly reassure your child of your presence and simply redirect your child back to sleep. It doesn't have to be too much attention, be neutral and be brief. Lastly, reward your child for sleeping alone. Sleep problems won't be resolved overnight. It's going to take a few weeks or maybe even a few months. So, with any small progress, we want to establish that reinforcement. So, definitely provide that praise and reward. Our second question is, what can I do with a child with anxiety? Most importantly, I'd like to know why the child is feeling anxious. Does it have anything to do with the evening routine? Does it have to do with sleeping alone? Does it have to be regarding the events for the next day, or maybe it's because of school? Once you can narrow it down to the core cause, maybe that'll give you an idea of how to proceed. However, some additional strategies that we can use is to promote activities that are relaxing and incorporate those soothing activities, and I've mentioned them in the webinar today, into those evening routine. If it has to do anything with the room or simply being alone with the room, try conditioning or pairing the room with positive and happy experiences, like I've mentioned. Spend some quality time in the room together when it's not bedtime. One thing I tried with a parent in the past was maybe go shopping to IKEA with your child and asking them to pick up different beddings or dolls or whatever that might make them feel comfy for bed and get them to sleep happy. Our last question is, what do I do when the child wakes up in the middle of the night? Again, try creating those sleep associations or sleep dependencies. Try to identify what the core cause of those wakings are, but like any other strategies for behavior reduction, following through and consistency is key. I understand it's not very easy to redirect your child to sleep every single time and wait them out, but I can say that if you're allowing your child to sometimes sleep in your bed and sometimes not, that behavior will only proceed longer. So we need to follow through. We need to stick with whichever plan we discuss. So being consistent is key. So that concludes our webinar today. Thank you for taking the time to watch our live or recorded video of this webinar. Again, please take advantage of the resources that are attached to this webinar. If you are a parent interested in these webinars with myself or other special education professionals in our team, or if you're just interested in our Village program, please visit our website or give us a call. Thank you and enjoy the rest of your day.